So I thought of something to share. Some of my trauma that I've been through and grieving is having my personal illness that I have to struggle with is bipolar 1. So it's a mental health issue. And a lot of people don't understand how painful it is and what would cause you to get angry or say or do things that, one time I had an art show and the person called me and they said, come pick your paintings up. And I was like, what? Because I was so manic, it didn't register in my brain. And so I didn't even remember doing that. And so sometimes you do or say things during your illness that you may or may not remember, or because of the chemicals, you can't control yourself as well. It doesn't mean you're dumb. I mean, I thought through and got so creative at certain times, and I ingested a lot of information, and then also went through some depression. But one thing about being in a psychiatric hospital is that when you check in, whether you go yourself or somebody takes you, no, your leg wasn't cut off. No, you didn't break a bone. No, you didn't have a heart attack. No, you didn't break your spine and have to lay in bed for 2 months. But what I call brain break, kind of where your chemistry is scattered in such a manner that a Band-Aid is not going to fix it, and you need to go in and have surgery on your brain. But that's not what they do. What they do is put chemicals in your brain to try to pull it together. And then that's what they call a breakdown, I guess. And so it takes a while for those chemicals to heal the brain. They can put them in there, but it may take several weeks. Our system right now does not allow for the recovery of the patients for that long. They keep you maybe 2 weeks, but it may take 2 or 3 months. So we do need outpatient housing and places for these people to recover on a less strict and less expensive basis than, full-time locked up psychiatric care. They need a little supervision and a place to see if the medicines are working. And then once the medicines are working, the people probably can return to work or work part-time or be a lot more functional in society. I think maybe the begging will end when we offer the people the time they need to recover from the illness. But just, if you've never been in a psychiatric hospital, maybe you're scared to go visit, maybe it's just you don't know what to expect. But call your person that you care about and tell them you're thinking of them and you hope they get better soon. If you feel comfortable, you can say, hey, do you want a visitor? And they may say no, or they may say, yeah, that would be great. But that's called love. And you support people that have psychiatric illnesses, and we need that. We need it on a society more accepting and loving to help stop some of the mass killings, too, because these people are psychiatric. They're in psychosis or something is wrong with them, and to get angry with a mentally ill person or a crazy person is not going to fix the situation. We have to change the situation so those things don't happen, which I would suggest in STEM, in the science area, that we teach brain health, every day a little bit, or, a couple weeks a year to engage the child and the family and also be better for the community. Plus the teachers need to know this too, because it is a day and age in which we do have treatment for mental health and a diagnosis, and most of us don't think the devil has possessed the person. We understand it's an illness. It's something in their brain, probably chemistry. And the other thing is we have children that are suffering abuse, neglect, their own mental health issues, autism, whatever. But as a safeguard for every one of those students and the family and the communities, we need to have an art therapist at every school. That when a child is disruptive, we need to send them to the art therapy room to get evaluated and diagnosed to find out what's going on. They obviously can't be in the classroom. And if they get violent and they're, doing something violent, they probably should go in a hospital, psychiatric hospital, to try to alleviate whatever's bothering them, because they're children. I don't know how you can just disengage with a child and throw them out into some kind of society or world that is abusive, probably to that child, and expect them to come back to a school and be any better. That's stupid. Who was it that said, doing the same thing over and over and over again, and not getting the results you want, you learn you got to do things differently. So I think every school needs an art therapist for individual and also to link the child with the community and the family and the resources necessary to have that child be a success in our society and our public school systems. Thank you.